All right, your next question, another back to basics, applying coding to payment policy. That's definitely up your alley, way more than mine.
Right, and that's a question that's asked all the time. You know, even when I'm speaking to students about coding, they always bring in the billing component and that. So, and it's really important for coders to understand this, because first of all, when we're studying for the CPC exam, first of all, we always have to remember that we're using the guidelines from the CPT manual only, and that's very important, particularly for students or CPCs who are already working with insurance companies and observe their reimbursement policies on a daily basis. It's just that the way CPT presents and the way what insurance companies adopt certain information, it's all relative. So in my own experience, even when I was studying for the exam, I always got inpatient E&M code questions wrong because I thought in the Medicare mindset opposed to the CPT. And it really makes a difference. Once you get that CPC and you get a real job in some healthcare facility or a doctor's office or whatever, you have to start paying attention to, and go to the next level. So that's just very important. So one of the most important factors associated with the CPC coding and insurance payments is the place of service code, and that is so important. So for example, I can have one podiatrist who will bill for a surgical procedure in an outpatient setting, while another podiatrist can bill for the exact same procedure in an office setting. And that podiatrist that performs the surgery in the office will receive more money based on the relative value units, which is basically the office overhead expenses. But when a procedure is performed in the outpatient setting, the outpatient department of the hospital will collect that portion of the overhead, paying the doctors less money. And I know for a fact, because I worked with the OIG on one of these investigations, where they were performing audits on physicians in rural areas who were coding the wrong place of service in order to get more money. And it's really fraud in its purest form. Because a lot of doctors in rural areas will get a stipend if they're on call in the emergency room or something, and they're supposed to be billing with the emergency department place of service, but because their patients come in, they automatically bill it as an office visit, and that's double dipping, and that's like really not good. But so let's assume that you get a job, you're a certified coder, you get a job, and you're going to work for a specialty, let's say neurology. And the first thing you do is you review all the procedures that the practice is currently billing for, verify if they're active or deleted codes, then run a list of the major payers for the practice. And then what you do is you go into every major payer website under provider manual and locate the reimbursement section. And you get the CPT codes from your list, and you work from that and print them out. I mean, you can print them or take notes. And what you want to look for are things like, does this payer want modifier 50 for bilateral, or do they want LT and RT? And every insurance is different. And so, and if you use the wrong modifier, your claim will get denied. I know for the CPC exam, they only work with modifier 50, but in the real coding world, you have to know what the payer will accept, because you don't want to waste time appealing claims. And every insurance is different. Some procedures are considered bundled into another procedure. We had talked about that last month, where at least Blue Cross Blue Shield of Mass, they bundle your analyses with office visits. Other insurance payers will pay them. And that's the type of information that you need to know. Some procedures are billable and other payers will not pay for them. And some payers follow the CPT guidelines. A lot of payers are starting to follow the Medicare Correct Coding Initiative, and some have their own set of rules. So you really, I usually say the top 10, the major payers for your demographic area, and just get the rules that are associated with the procedure codes that you use. And also remember that Medicare and some other payers may require HCPCS codes instead of CPT. So for example, if you have an administration of a vaccine 90471, and that, say, goes to United Healthcare for a flu shot, but Medicare requires G0008. G0008, right, for this administration of a flu shot. So they both mean the same thing, but it can affect your reimbursement. And also, all the information from the payer that's provided to you, you want to be proactive with this information so that you can ensure payment. And if you receive a denial on an explanation of benefit, use it as an opportunity to see why the claim was denied, and you'll learn about the coding and what's expected from that payer if something you missed in the printouts or anything. And you just take that knowledge that you have obtained studying for your CPC and use the same process, but you're just following different payer rules. It's so similar, but they are a little bit different. And so you learn how to code is the first phase of your coding career, learning how to code. And then once you are employed, you just do your homework and gather all the information ahead of time to know what the payers expect, and that's how you'll get your reimbursement. And the last thing is study prior EOBs and see how the claims were processed. Trace it back to the original encounter form if you have to, and watch the flow of the claim being processed. You can learn a lot by studying an EOB and seeing what modifiers. I mean, there were times when modifier 25 would not be accepted by some states in New England for Medicaid, and now they accept it. So you have to really know what each insurance company requires, and that's how you'll get paid. And even whether you're a biller or a coder, the coder also has to know what the payer's rules are in order to code it properly for the biller to key punch it if the biller doesn't take it full circle. So, and that's that.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.